this, that, and the other. We have to look at that very, very carefully. So I go in and ask the CEO, can the health department fix this facility? We've got COVID now. And she smiles and gives me the same answer that every CEO of every hospital told me. The email will come back. Sorry, there's no budget in this financial year, maybe in the next financial year, but even in that, there's no guarantee. The crisis is now, not next year. It has to be done right now. So I asked, if I intervene, is it fine? And she says, yes. And all our interventions, from the first PPEs we delivered to Chris Hani, Helen Joseph, Rahima Musa, Charlotte Makeke, Tiger Berg, Krotaskir, Albert Lutuli, at 210 hospitals in the country. No MOU, no agreement, no signing of forms. We just walked in and delivered it. Every hospital we upgraded, no issue or paperwork. In this particular hospital, it was a word of mouth, just do it. Within 5 days, we fixed up that facility and had a 30-bed high care facility that both public patients and those on medical aid can use in the hospital. And they said they don't have to go to Port Elizabeth, Jamaica, as we know it today. They don't have to go there, they can use this hospital. Now, a little bit of intervention makes a huge difference to the lives of very ordinary people. That's why we did healthcare. We came to make a difference to the lives of the people, emotionally, physically, mentally, spiritually, and in every way. We came to fix the health system, and we came to see how to treat our patients. And in the process, we've got to fix the health system. My congratulations to that CEO who didn't wait for any instructions from anyone, didn't wait for paperwork, and just got it done. At some point, 2 or 3 weeks after our delivery started at Chris Hani at Gauteng hospitals, and as I said, we covered 210 hospitals in the country. Somebody from Gauteng Health got very clever and called and said, you know, you can't just deliver to a hospital. You're going to have an MOU. You're going to write a letter to us. We have to have it in writing. We've got to respond to you. So I told him, my friend, stop there. This is a disaster. Government doesn't understand 3 words. Urgency, emergency, and disaster is not in your vocabulary. Do you want the stuff? Yes or no? Do you have alternatives? Can you supply? And the guy backed off and said, you're free to go to every hospital. Do what you want. No paperwork, nothing. Just do what you want. The aim was not to outdo government. The aim was not to show them up. The aim was to be complementary. We understand there's budget deficits. All countries in the world are suffering with that right now. Yes, you will tell me there's corruption, there's state capture, there's wasting of money, my contracts are given to people, the items are not delivered. Yes, all that is true. But what is also true is that 7 million people's taxes can't look after 65 million people, and that's impossible. Whether the Americans, the Germans, the Canadians, Australians, anybody from Europe or in our country are going to have the same problem. The tax base is far too low. The unemployment is too high. The social demands are too high, and no government in the world can manage that. So whilst we're fighting for an equitable system, and we're talking for accountability and transparency and good governance, strengthening the SIU, the Hawks, the NPA, we as a public, private and public both, need to see what we can do to improve the care of health of all people in our country. Because again, I emphasize, we could be on the other side. And the other side, you all know, is not very pleasant. So we go ahead and we fixed hospitals, we fixed the doctors, so not all of them, we started the process. And we get buy-in, and we get support. What has happened to all those hospitals that we went? The public health doctors that were working inside there suddenly felt very motivated. We then brought in a project called Hospital Heroes. Now, all of you in the private public sector get damn good salaries. So for you to afford a small handout or a small toiletry pack is nothing. But the fact that it came from outside, from patients, from the public, acknowledging your service to them. I told you, healthcare workers are regarded as God. And because of that service you gave people, out of love, they sponsored and gave those items to you, which you could afford 100 times over. But to your favor and to your credit, you accepted it graciously. It boosted your mood of the consultants, the registrars, the medical officers, the nurses, the porter, the security guard, everyone. That brought unity in our system, working together as healthcare workers. And there was just so much of joy in that pain and that hardship and the difficulty. Whilst doing all that, another challenge came. And again, all this exposes the serious problems that we have in the healthcare system, both public and private, where ethics is an issue, where pricing is an issue, where access to service is an issue, and the public health service, everything is missing, and nothing is functional. And it's a huge challenge. And one of the huge challenges is corruption, as you know, at Tembisa Hospital and other places. But it's something that really irked me. In December 2020, I'm standing in Tigerberg Hospital, and the intensivists are telling me we've got a serious problem with the beta wave, that the patients are dropping dead in front of us, the happy hypoxics. Kylie Hospital says the same thing, and you speak in Eastern Cape and everywhere else, everybody was going through the same experience. So I asked, what's the solution? They said we need machines, oxygen delivery devices, but oxygen points. There's not enough beds for ventilators and ICU. Strangely enough, whilst they were saying that, those machines were already ready. Apparently, somewhere in June of the same year, Minister of Trade and Industry, Ibrahim Patel, had requested that the scientists of South Africa, a good move by government, that the scientists of South Africa should get together and design an oxygen delivery device. The guys from the SKA telescope and a lot of other scientists and engineers got together, and they formed the National Ventilator Group. And in that, a whole lot of proposals were put forward, and eventually one was selected. That proposal that was selected eventually was approved, and it was the model for a CPAP machine. CSIR, which also belongs to government, manufactured 20,000 of those devices. SAHPRA approved it for temporary use for COVID only in South Africa only. Solidarity Fund attached to government paid 250 million rand for those 20,000 machines, which was not unreasonable at 12,500 rand a machine. Actually, it was a bargain. What was the problem? At the same time that I was standing in Tigerberg Hospital, how is it that the man, one of the people behind the project, a Professor Justin Jonas from Rhodes University, calls me and says, we got a problem. He tells me all these things that I told you. Ibrahim Patel, CSIR, SAHPRA, Solidarity Fund, 20,000 machines ready. And he says we can't get it into government hospitals. So I asked, do you have a transport problem? He says transport is not the problem. The problem is that we are being blocked. So I said, are you telling me that the government, all the government entities spend all their time and money making a machine that you can't put it to the government hospitals? He said, yes, that's exactly what I'm telling you. Again, there's an endemic problem in the health system that has to be fixed, because medicine is not about ourselves. It's about service to people. It's not a job. It's a calling. It's a very spiritual calling where we serve people with distinction and we give them hope and dignity and put a smile on their face in the most difficult of our own times. So I tell the man, where are these machines? And he says they're in Cape Town. So I said, I'm in Cape Town too. Can you send some to me? He sends them to me and I give it to the guys in Tigerberg. And they say this machine had just saved some lives. We then went to Khayelitsha. I said, let's try another hospital. Gave it to them, and a few hours later, they tell me the same thing. We've just saved us some lives. We had a chat group of all the CEOs of hospitals in the various provinces. And because Eastern Cape was very badly affected at that point in December 2020, we put it on the Eastern Cape chat group. And without exception, Every single CEO of every single hospital in the Eastern Cape put up their hand, we want this machine. We didn't ask for permission. I just said, send me the machines. We delivered 500 CPAP machines to several hospitals in Eastern Cape within 48 hours. Credit again goes to the CEOs, the junior staff, the senior staff, the background people who cared for their patients in spite of their own fears of COVID. The CEOs of certain hospitals waited till 11 o'clock, 12 o'clock, midnight, 1 o'clock in the morning for those machines to come. And when the machines came, they didn't say, we'll look at it tomorrow. They took it and put it on the patients immediately. On Monday morning, the first call came from the CEO of Kala Hospital in the Eastern Cape. And he said, today, me and my teams are smiling. Actually, we are laughing. And so I said, why? He says, every Monday morning, we count, it's very morbid for us. We count all the dead over the weekend that died from COVID. Today we're smiling and we're laughing because not a single person died. Those machines saved the lives of every person in this hospital. Again, there's good naturedness in our country. That was a good move from government, brilliant scientists, Solidarity Fund putting the money forward, CEOs asking for support for their hospitals, people delivering it, and patients getting the benefit of these machines. At least a mother will see a child again when she goes home. Parents will see their family members again. Relatives will see each other because of a simple intervention to dedicated, committed staff. When I saw the power of what those machines did, I went to Solidarity Fund and said, look, can't we give this to the private sector also? Because whilst they may have the money, they don't have access to this machine. And you guys are not selling this machine because it's a donation, so you can't sell it. At the end of the day, it's not about the private hospital or the private healthcare practitioners. It's about the people they serve. And whether you're private or you're public, you're still South African. And you still belong to our community. And you still belong to our country. And we are all one. It's just that our class status and our financial status separates us into public and private. But essentially, we are one single nation, just with different economic strata. To the credit of Solidarity Fund, they said, we need to speak to some of the guys on the board. What in 5 minutes, no exaggeration, what in 5 minutes, they got back to me and said, do what you want. I offered it to the private hospitals, and the group started taking it on. I'm not going to mention the names of the hospital, but some of my medical teams work in those hospitals. And one person calls and says, we'll try 6, because they came in boxes of 3. Calls me a day later and said, can you send another 18? Calls me another day later and says, can you send another 24? And I said, but where are you putting all these machines? And they said, we've opened every single ward where there's oxygen points, and we have enough of those. And we're opening all those wards to take in patients from private and public. Now, I didn't say, okay, you got this machine for free, you can't charge too much, you got to give a reduced rate. Your own ethics and your own morality should police you yourself. You don't need outside people to police you. Your conscience should allow you and say, or dictate to you, I got this machine for free. It's not for money making. Yes, you don't want to run at a loss. It's obvious. Any company doesn't want to run at a loss. It's not for money making. It's about saving lives. We got it for free. Let's be ethical in how we charge, what we charge, and who we charge. And of course, there's a lot of people with that kind of thinking in the public and private sector. So the machines were put in and lives were being saved. Then we faced another challenge. Everybody said the message is going around, sanitize or wash your hands. They said, how can we wash hands? There's no water in hospitals, especially again in Eastern Cape. Drought situation in many places. We preempted the drought situation and we put in bores in several of the hospitals in Eastern Cape. We then had to extend it from washing hands to connecting to theaters, to ICU, to the linen room, and all other areas to fight infection. So over the months, we started putting a lot of boards. Again, coming back to the fact that in fixing our health system, that NHI can't work unless we fix all the problems in our health system. And there are 5 critical problems in the health system. Number 1, poor management. Number 2, absence of maintenance. Number 3, failure or inability for infrastructure upgrade. 4, lack of supplies, be it machines, equipment, consumables. And 5, not enough healthcare workers. And that means nurses, doctors, and what we spoke about in the beginning. Those 5 areas are critical areas that have to be fixed. Qualified, professional people who know how to manage hospital, who know how to manage strikes, who know how to win people over, to guide them to do their job that they're appointed for, or what they've selected themselves. Their job in the health field is a calling. It's not a business. It's not work. You can't neglect patients. You can't block doctors from seeing their patients. That's totally unethical behavior. Where did we learn such things? We're told in religious teaching that he who saves one life saves the whole of mankind. But the behavior of some of our staff in some of the hospitals leaves much to be desired, preventing patients from delivering, preventing from gynecologists getting to the patients. Totally, yes, you may have a problem with the system. That does not give you the right to infringe on the rights of patients who've come for care and come for hope and come for support in the hospitals. So we did the hospitals in the Eastern Cape. Who would have thought that the richest city on the continent, Johannesburg, will not be able to fix the water problems in their own hospitals because something went wrong with the municipality and water's been cut off from the south of Joburg, and nobody could find a solution to that. We walked in again to the credit of the CEOs of Helen Joseph and Rahima Musa Hospital. We drilled boreholes there within 24 hours, put in the connections to all parts of the hospital, and a few months later, the problem came that the water supply is not enough. It's getting cut off too regularly. Load shedding is affecting the reservoir from getting full. So we drilled additional boreholes. We got 3 in Helen Joseph and 2 in Rahima Musa, and hopefully now, the water supply is more than adequate. And whilst doing that, with load shedding, we then sent in an engineering team, Rahima Musa, again a prototype. Whatever I'm saying is our 1 or 2 hospitals. It's something that we've got to replicate throughout the country in selected hospitals to improve the quality of patient care and patient well-being. So we got a team to look at solar power to take Rahima Musa off the grid completely. If we achieve that, that can be done at other hospitals. Again, it can't be done with government. It has to be done collectively with corporates, generous South Africans, different trusts, international money. It's all about, we're not doing this for government. We're doing this for the people of South Africa. And as an aside, just to give you a clear message, the country doesn't belong to the government. This country belongs to me, to you, and to 65 million South Africans. We take ownership of our own country. We help ourselves. We fix systems. Yes, you pay VAT, and you pay tax, and you pay a fuel levy, and you pay a lot of other things. But come back to the point, 7 million people's taxes can't look after 65 million people. And until that system is corrected and fixed in government, where there's many more taxpayers and the base increase, our compassion, which is what we should be having since we all became medical healthcare workers, that's the primary quality that we should have is compassion and mercy within ourselves. So as that compassionate, merciful individuals, we support the system and hold it and pick it up till the government can take over and fix the system themselves. What our support, of course. So about NHI, there's no discussion about that. We need healthcare access for all the people in this country. They don't have to wait in those long queues. What sin did a child from rural Transkei do? That when he gets sick, there's no taxi, there's no ambulance, or the ambulance is not working, the road is not functional, it's not safe to drive at night, it comes to a clinic and there's not enough support, it gets sent to a district hospital and there's not enough medical staff, or the guys are not doing their job properly, or there's no medication. and the child gets no care simply because it's a poor child. If it was our child, my child, and your child, what would that do to us? It will destroy our inner being. It will destroy our dignity. It will break us. And at this point, let me say clearly, hunger won't destroy South Africa. Children are dying of starvation every single day in the Eastern Cape, and it's been going on for a long time. Now we're finding hunger all over the country. Racism won't destroy this country. We had it for hundreds of years. We're still standing here. Class distinction won't destroy this country. We had it also for a long time. What will destroy not only this country, any country in the world, is when people lose dignity and are totally humiliated. When they've lost everything and there's nothing to lose, then there's no consequences for negative action. Lack of dignity and humiliation leads to negative actions, negative energy that destroys society because people have nothing else to live for. And when we reach that stage, we are at a very, very critical point. And one of the things, I'm talking to healthcare workers now, you can play a role in dignity. Yes, and the teachers got to play their role, and the guys with water got to play their role, and the guys providing food got to play their role. But all of us collectively got to play our role. Again, why is in Eastern Cape, in Transkei? How do you explain to a parent or parents, sorry, your 2-year-old child fell down a pit toilet and drowned in feces? Imagine what that happened to your child or to your grandchild. Those are the realistic things people are going through in this country, and still so patient, still full of faith, still sitting with hope that somebody, someday, is going to fix this for them. We started seeing an alarming increase in undernutrition and disease and death associated with that. And we asked, why don't you come to the hospital on time? The parents tell us, hunger is quite normal here. We're hungry all the time. We don't go to hospital. So when we're hungry, our children are hungry. And so as we bear it, they bear it. The difference is the adult survives, the child dies. And they come too late to the hospital and the children die. We then intervened with the MEC for Health, the head of department, the dietitians, and we said, this province needs a radical education process in community health and about nutrition. We need to educate, we need to teach, and at the same time, we need to intervene with something nutritious. We started using what is called Easy Peanut Paste, a product made by a company in Norway, but sold in South Africa and comes from, I think, Muizenberg or somewhere in Cape Town, Mowbray, I'm not sure which place. But anyway, it comes from one of the factories there, but it's designed in Norway. We started distributing it, Easy Peanut Paste, rich in protein, micronutrients, and it's nutritionally enriched. It's got a pleasant taste, the kids love it, the adults love it, and makes a difference. So we started rolling this thing out at our cost. To our good fortune, the company that makes the product saw it on our social media pages. They called us and they gave us 25 million rand, 15 containers, 25 million rand of the product, which we rolled out throughout the province. That made a significant difference to the level of healthcare, but also, besides the level of healthcare, it brought relief from hunger pains. It brought hope to those families. And we're supporting hundreds of soup kitchens and rolling out thousands of food parcels in the interest of helping people, because there's a social dilemma in this country. There's not enough money, there's not enough taxpayers, and we collectively have to fix that system. So these are all the challenges that we came across during the time of COVID. And we saw burnt out doctors, demoralized. And in fact, tomorrow, I'm in one of the hospitals to talk to doctors about the whole issue. All they want is a little bit of support, a little bit of encouragement to carry on. And again, my admiration for those healthcare workers that stay in the public service, but all the challenges and the insults and the shortages and the hardships, that you stay there for one purpose only, to serve your fellow being with distinction, with compassion and care. And there's many of those throughout South Africa. I've met so many who went and studied further to improve their degrees, went away to other countries, went to the best units in the world, and came back, and you would think that this person is now ready for private practice. And they said, no, we didn't study this to go to private practice. We studied this to come back to serve our people. Nothing wrong in being in private practice. You also give service in that way to people who want to come to a private hospital. Absolutely nothing wrong with that. We just need to moderate the way we treat people. Are we aloof? Are we accessible? Or are we God's gift to mankind? Is that our attitude? And many of us in the profession have that kind of issue. Ego and thinking you're the best thing that the world is, that you're the best thing that's been created in this world. That's a major, major problem. So we have to compliment, again, healthcare workers who are dedicated, and I've met so many good ones recently, studying, got the exams, and went back to the public hospitals. The other big challenge, to show you the difficulty and the enormity of the challenges in the hospitals for poor people. In November last year, CEOs, again, my credit goes to them, started crying. They started crying because they care for their patients. And they called us and said, we don't know what to do. We don't have food for our patients. We can't feed them. Besides having inadequate medical care, now they come to the hospital and we can't feed them. And they're hungry. Men, women, young, old, children. What do? We said we'll provide food for every single hospital. Not the driver. The CEO himself or herself jumped into a bakkie and came to collect the food from East London, from our warehouse there. They were humble enough, committed enough, dedicated enough to come and drive a bakkie to collect food in bulk for the people that they want to love and serve and show love to. This is medicine. This is what we all train for. This is how we all should behave, and to make a huge improvement in the healthcare in our country. So yes, infrastructure upgrades have to carry on. Boreholes have to carry on. Solar panels have to carry on. And again, a credit to all those healthcare workers who call, we need this machine. We need these consumables. We want to catch up something here. We want to catch up something there. Credit goes to you, and we've supported all of you that have asked. A big project that we want to embark on now, and we're creating the idea among corporates, is the funding of registrars. By cutting registrars, you've actually destroyed the health system. We want to have consultants, in other words, specialists, in all the different fields. So going upwards, we're in a serious problem, and going downwards, we're in a serious problem also, because a lot of the junior doctors train and learn from the registrar. Consultants come once in a while, so they don't have that much contact. They do the TATs once a week, but the daily learning is for the registrars. And if you cut the registrars, we essentially have destroyed the health system. So to me, that's the most illogical place to cut money in the health system. But it has happened, and we need to fix it, augment it, or support it. I'm approaching corporates, and we're already sending the feeler out. Help us fund 500 registrars in South Africa. You're talking about 1 million, 1.2 million per person per year. But we need a commitment for 4 years for those registrars to qualify. If we do that in all the different disciplines, we'll make a huge impact on the health system. Quality healthcare, dignity, people supporting each other, motivated health staff. Because if we put extra registrars, we'll say you won't get 4 calls a week or 3 calls a week, you'll get 2 calls a week or a little less than what you were getting before. That gives you more time to study, to be a better healthcare worker. And at the same time, we have one request: spend more time teaching those students below you. During the time of COVID, our students lost out on training. Everything was virtual, not being in the ward, afraid, no practicality, everything theoretically. And a lot of kids that you see them now, they are really battling. So we as the elders, the more qualified ones, the more specialized ones, we need to take some time off and teach the younger generation, because they're going to be taking care of the health of our grandchildren and our great-grandchildren. they're going to be taking care of that health. And we need to equip them so they do their job properly for our children and our grandchildren and beyond that. Again, it's a collective approach where we put our country and our people first above everyone else. So in terms of practicality, we're still supporting infrastructure. We're still supporting boreholes. We're still supporting equipment. We're still providing food. We're still providing consumables here, there, wherever necessary. The registrar program is the next big program, which we want to fund. And right now, as an additional support, the Red Cross Children's Hospital, after 4:30, does not have any funding for the poison center. If anybody calls for some help for somebody, some child's ingested something, there wouldn't be anybody to answer the phone after 4:30. We are funding it for last several months. The after hours part of it, not the day part of it. From 4:30 onwards till the next morning, we're funding that. Even if we saved one child in the 6 months, it's worth it. But the calls are far more than one. We get the reports all the time. It was an intervention to save the lives or to assist our healthcare workers in the country and outside the country. And then came the big challenge after COVID, which was there before COVID also. The absence of enough time and space to do surgery. I mean, some surgical cases, we got a backlog of 7 years in some type of disciplines. Credit to Fortis Care Hospital. Professor Lydia Cairncross in a meeting said, I want to do catch-up surgery. We got a program, we got an idea, the blueprint is ready, we want to do this. Bring in a complete outside team to work with the inside team, so the existing everyday patients are still seen and not compromised, otherwise the backlog just gets bigger, and a separate team takes care of the black backlog. We put 5 million rand into the program. The Western Cape Health matched it with the 5 million. Some generous, well-meaning youths started doing bungee jumping, went in the Sisikama River, did some climbing the mountains, some adventurous stuff. They said they raised 100,000 rand. They raised R1 million to their credit. Again, in the interest of the poor, the marginalized, the people who have no voice. They did it for those people. To the credit of the Western Cape Health Department, they matched that million also. And another 3 million had to come from individual donors, and I think they've made that money to catch up 1,500 surgeries. In 6 months, they had already passed the halfway mark of 750 in a half a year. Dedicated, committed people. But do you know what it does for the patients who go through that? It's priceless. Eastern River came to us and said, we want to do cataracts every 2 weeks. We said, we'll fund it. Incredible response. The guys from Tigerberg came and said, we have a dialysis program, but we can't fund them all on the system. Can we do it privately? Life, Vincent Pallotti Hospital said, we'll cut the rates. And Braun Group said, we'll cut the rates and give us. That is empathy. That is care. That is making privately and making money privately and putting back. And it became affordable. And 15 persons within 2 months were put onto the program. We're funding it, but it's not a ridiculous price. It's something that's making a difference to the lives of the people. I was in a manufacturing facility, or not a manufacturing facility, a warehouse that stores books, that distributes 45,000 books to different companies, schools, universities, medical facilities, the public, the bookshops. The book that was written on Gift of the Givers was stored in that place. So I went to see them to thank them. And when I left, my wife gives me a note. And when I read the note, the lady says, thank you very much. My husband was critically ill. You don't know me. You don't know my husband. 3 weeks ago, he was almost dead. But because of your dialysis program, I have my husband here today with me because you funded that. I was at the Eastern Musical Show at the Cape Town International Convention Center a month ago. The funds raised, a portion of that was coming to Gift of the Givers for any type of project. I bumped into a girl and she says, I was dying, exactly the same thing. I'm on your dialysis program, not mine, Tigerberg and Vincent Pallotti, but we pay for it. So they come out from nowhere and they have this gratitude in their heart because you made something different for them. You gave them an opportunity to look after their children, to be there for their husband or their wife, to be there for their families, and to be productive in society. Now we have the power to do that because we control the most powerful thing on earth, health. Without health, you are nothing. Money is nothing. So let's go back to COVID. A man could come to the front door of the most expensive private hospital in South Africa. And I can tell you, hello, Mr. CEO, I need my family to get a ventilator, an oxygen machine. I need an ICU bed. I got 2 billion rand in my account. I know the president personally. Minister of Health is my friend. I know the DG, and I know the group CEO of your hospital. I need the bed. Do you think the CEO of the hospital is going to take out a patient that got 50,000 rand because you got 2 billion rand? It's never going to happen. Fortunately for us, our medical ethics in that way is very, very strong. It's never going to happen. And you, with your 2 billion and your relationship with the president and the Minister of Health, now to die, drop dead right in front of that hospital. Money is not everything. We have another teaching. What you don't spend is not yours. So you can make 1 billion and 2 billion and 5 billion. Just work it out. How many lifetimes you're going to need to spend that money? So could you take something and give back a little bit to make a difference to something, to someone that could have been your child, that could have been on the other side? This talk is about arousing our conscience because our country needs us, public and private both. Collectively, nobody's saying again, don't make money. But let's be reasonable in the way we charge. Let's be reasonable and put something back to make a difference to the lives of somebody else in our country. And you guys have the capacity. Many of you have proven it already. All the guys in the public health service who are overworked and strained and challenged and irritated by the CEO and the medical manager still come forward and said, we want to do this. A month ago, one of my team members, who's the head of general surgery in Kimberley Hospital, Robert Mangalizu Sibuku Hospital, calls and says, we want to do catch-up surgery. We have 2 problems. We've got all the surgeons, we've got the theaters, we can take the aftercare, but we don't have scrub sisters and we don't have anesthetists. Can you help? Again, I put it in my chat group. Within minutes, 5 scrub sisters and 5 anesthetists are ready to fly. If you need more, no, I don't need more. 10 is enough. In 60 hours, they wiped out 71 operations. One lady puts her hand up and says, do you know how many months I've been sitting in this bed? I haven't seen my small child for all these months. Today, I'm going home to see my child. The implications of what we do, the ramifications of those things are huge. We don't understand that because we don't go through that kind of difficulty. So the credit again to those hospitals, that those kind of dedicated staff who want to do the catch-up surgery. And thank you to all the volunteers, public and private, who want to get involved and make a difference to the life of the people. Fortunately for us, compassion seems to be coming back into the medical field. I recently opened up a facility for one of the private healthcare groups, and they said they are funding oncologists to support Richards Bay Hospital, hospitals in Richards Bay. They at their cost because there's no oncologists in the government. And for so many other things they are paying. I've met the CEOs and heads of medical managers of various health groups in the country. And all of them are saying, we want to put back. Either the facility will be free, or we just pay for some consumables, and we try to get support from the private sector. Those companies that we buy from get the consumables for free from them. The fact that the idea has come from the private hospitals themselves is very, very beneficial and very motivating. I was offered Fourways Hospital, I was offered Brenthurst and other hospitals in the country for free. Now, my request to the private guys is, The hospitals are being offered to us for free. We need your time for free in all the different disciplines. Half a day a month, half a day in 2 months in 1 month is too much. Half a day in 6 months, or half a day in a year. All we ask you for that time, no charge, full commitment, full dedication. That when we make the programs work, whether it's us or any other organization or any health facility, it doesn't really matter. Anybody, let's make a difference to the lives of those people who've been waiting for so many years, patiently, looking up to God Himself, you guys, the healthcare workers, that can make a difference. And fortunately, there's a lot of dialogue taking place now, and a lot of healthcare facilities want to do all types of catch-up surgery at minimal cost to the outside party, and they want to absorb most of the costs and get buy-in. And there will be corporate buy-in, but will make a huge difference. I want to finish off with two more stories, two more explanations. One is, in February, as part of our Soup Kitchen program, we support a place called Tosrafir. That place was dependent, Transnet was supposed to put some railway things there, and people were supposed to get lots of jobs. It didn't work out. And then the game reserve with COVID also collapsed. The town has an 85% to 90% unemployment rate. People were hungry. 10 kids a day, then 50 kids, and then 1,500 people a day were hungry. We support that soup kitchen. In February is stationery time. So we go to the school, we give out stationery, and a child is sobbing in the hall. And we ask the principal, why is this child crying? And the principal says, the child's got a toothache. So common sense approach, get a dentist, pull it out. And the principal looks at us and said, there's no dentist here. There's no proper health facilities here. There's a clinic that's sometimes functional and sometimes non-functional. Sometimes the doctor comes and sometimes the doctor doesn't come. And sometimes there's medicines and sometimes there's no medicines. And the queues sometimes are too long and people can't wait. The nearest hospital is over an hour away and people can't go. Nobody's got transport. Nobody's got money. The ambulance doesn't come. Imagine if we were that community. Imagine if we were living like that. What would happen? It destroys your soul. So we said, how many kids got a tooth problem? We said most of the town, adults and kids. So we took in an intervention team with 50 healthcare workers, dentists, physicians, orthopedic surgeons, general surgeons, gynecologists, all range physiotherapists, and the entire town came. Our dentists pulled out teeth from 500 people, mostly children. What was amazing, the chairs were put up in front. We didn't have screening. There was no place to do that. It was rural. We put the kids on 10 chairs, and the other kids are watching their friends putting the teeth out, and they watch them scream and cry and shout and roll on the chair. But they came and sat immediately after that in the same chair. It was easier to take the pain of the dentist than to take the pain of the tooth. And they made a joke out of it. They said, now we're going to look at our friends and we're going to laugh at them when they're crying. And when they finished, they're going to sit on the side and they're going to look at us cry when we go on the chair. A 5-year-old child walks in alone, no parents, alone, to come and pull her teeth out. That kind of desperation, it's easier to take the tooth out than worry about what's going to happen on the chair. And you admire people like that who are going through that kind of difficulty. But the biggest tragedy in that mission was that the first 300 people who came in, we couldn't see them. Do you know why? They wanted to test the eyes. We don't test eyes. And we said, sorry, we can't help you. And we understood that many of them for 5 to 7 years were sitting not with hypertension or diabetes or glaucoma or anything else. They just couldn't see. Visual acuity problems. They couldn't see. They needed glasses so they could read the prescription, watch the TV, read their messages, and the kids in school were failing because they couldn't read the board, and the teacher thinks you're stupid. It broke my heart to see such a situation. Completely debilitated because they didn't have glasses. By God's grace, in August, we met people in Cape Town to do glasses. Late end of August. In September, we took in a second team, 80 personnel this time. Again, credit to everybody who works together. The school principals who opens the school, the community workers who brings the people together, the taxis that bring the people to the hall, the healthcare workers, Europcar that gave us all those buses, 10 buses for free, the medical companies, Austell and others giving us stuff for free. Everybody who supported it, and even the staff from Austell came directly to help with the drug dispensing, and the medical teams who came up that Saturday morning. And then credit goes to CPUT, the African Eye Institute, and that's the foundation who made things happen. And the two ophthalmologists who came. Between the ophthalmologists and optometry students, they tested 600 people for eyes. A huge test. 50 patients need cataract surgery. Because of the queue and the backlog, it will be done in February next year. There's no point telling a person you got cataracts and then say, okay, go home now. You're going to be decisive. So the queue is booked for February next year at East River Hospital. We'll send a bus, bring them across, do the procedure, and send them back in a bus to go back home. Today, I'm so happy. Those kids that we tested and those adults, 83 of them needed glasses. And today, there was jubilation in Toserfield because all 83 of them got their glasses. No charge. The companies didn't charge for the lens, for the frames, for the procedures, for flying some stuff from out of the country into South Africa, special lenses at no cost. Now, this is what healthcare is all about. And my appeal to the healthcare sector, both private and public, we need to join hands together. From the CEOs of the hospital, from the specialists, the ordinary people, we need to do this not for the government, but for our people, because we could have been on the other side. And one final word, I got to say this directly. Many of us do moonlighting, nurses and doctors. You have an ethical responsibility to serve your time in the hospital for the hours that you paid for. And unfortunately, many of our colleagues disappear because they've got private practices. That's totally unethical. You've left the burden on your fellow healthcare workers in the hospital. You've neglected the patients that you've been paid for to see. You've affected healthcare in the system, and that's just not on. If we are doing that kind of practice, we need to stop because we have a commitment. We've been paid that money from private tax, from taxes of the public, not that the public minds you getting the money, but do your job. See to your patients. Nurses moonlighting, going away, taking off sick. Please don't do that. Because tomorrow, it could be your child or your grandchild that was denied treatment because of the practice of something that one of us did. Thank you very much, friends and colleagues. As I said, I'm a very blunt guy. But today, this holds as a webinar is to reopen our minds, to relook at our conscience, and to see how we can work together in the best interests of our people in South Africa, because they are suffering, it's untold suffering and misery. We can make the difference from a health point of view. Thank you very much.
Phew. Okay. I'm somewhat speechless. Dr. Suleiman, that was absolutely incredible. I wanted to mention before the talk, and I'm actually quite happy that I forgot, or didn't forget, but just oversight. And that's, we can understand why Dr. Suleiman was awarded the prestigious Lifetime Achiever Award by the BHF. I knew you did a lot of great work, but I really didn't know the extent of it, and I'm truly blown away. Thank you so much for sharing your words and your insights, and certainly your inspiration. It's absolutely fantastic. Thank you. Okay, we're going to take some questions, and the first question is, what can we as non-medical personnel do to help improve the mental health of healthcare professionals? And they are still suffering daily and are exhausted.
Non-medical in which sense? Is that your field? If they mean people do mindfulness, people who do yoga, people who, I mean, that's that's an option for healthcare workers to choose themselves. The fact that they're offering the service, the healthcare professional has a right to say, yes, I want it or not. But to be honest, to see on the chats, the healthcare workers said anything that will relax them, whether it's prayer, whether it's yoga, whether it's mindfulness, whether it's psychologists, whether it's a psychiatrist, whether it's some kind of exercise, people were prepared to use that. So yes, if you have the skills in any of the things that I mentioned, or something that I don't know about, I don't know all the non-medical stuff, but whatever you can do that can make a difference and you see it works, it's the choice of the healthcare worker. If it finds it works, it's going to tell more people to come. So you can play a role, yes.
Okay, the next question. What is your take on healthcare professionals who intentionally went out to destroy equipment, especially in the private sector? Surely they should account for their actions. I'm not quite sure which incident this is referring to, but that's the question.
I've already given an answer explained that when I spoke about the hospital and settlers. That's totally unethical and outrageous to behave as, first of all, as a medical professional like that. And secondly, somebody that deals with life and health, and you see what happens when there's no equipment. It's just outrageous. So it's unforgivable. We're not going to know who did it and when they did it and how they did it. It's also about accounting for yourself.
Okay, another question. Should we not continue in the venture and improve the quality of care in public hospitals as if COVID-19 is still active? We need to stay prepared.
Yeah.
I'm not sure if that's referring to the government or individuals or both.
Well, it's all of us, because collectively all of us were affected by COVID. And a virus doesn't say, okay, I'm only going to go to the private hospital. I'm going to go to certain areas in the country. I'm not going to go to the public hospital. Anything in health that affects one of us affects all of us. A fire here right now in Port Elizabeth has an impact on the whole country. The sheep dying in Sutherland from drought has an impact on agriculture, on GDP, on profits, on rates, on inflation, on foreign earnings. There's no incident in the country or no event in the country that we're immune from. So in the same way, in the health sector, it's better to be prepared than not to be prepared. And all the hospitals and the CEOs, and let's give credit to the hospitals and the management. They found ways of setting up their own wards, creating COVID facilities, moving patients around, shutting down theaters, cutting out elective surgery. They applied their minds. We just have to keep applying our minds in a non-disaster situation in preparation for the next disaster that comes.
Sorry, I'm being distracted by kids. So there's another question. Would you like to run for president?
No. It's in 1994. A spiritual teacher saw this 28 years ago. In 1994, my spiritual teacher told me then, well, just after 94, he told me, I think it's close to 95. He told me, my son, you will never get involved in politics. You'll never work for government. You'll never be in government, but you will always work with government. And for 30 years, that's what we've been doing.
And doing it admirably, I must say. Okay, there's a question here regarding being a whistleblower. And if you are a whistleblower, you're victimized and targeted. I guess like we saw with the pediatrician at Rahima Musa. How do you do the right thing when your heart tells you to do that, yet you under threat daily? Should you go with your conscience?
That's an individual choice. Whether your conscience is more important or the threat is more important, and you decide which way you're going to live. And it's the same challenge that everybody faces. It's not an easy choice. It's a very difficult. You consider your family, consider your friends, but I have one policy: do what is right. And if you do what is right, you'll always be successful. Yes, you will suffer. You'll go to hardship. You may even get killed. But you did something that's right, that in the long run will benefit all of society.
Okay, there was a question that's been posted now, which I wanted to ask, and that is, how can people get involved?
The greatest service you can do is exactly what I said: do it yourself. If you can involved.
Yes, involved with
Well, For healthcare professionals, the only way you can get involved with us is when we have disaster teams that go out. Now it's expanded beyond that. So, for example, we have a call, there's an earthquake, a flood, and we're going. We put an appeal to say, we've got our own teams, we've got a core team, and we can make up huge numbers from our core team, but we always allow new members to join. So if we make an announcement, we go on a mission, you just send a message and say, I'm ready, I want to come. And if there's space, or we do allow space for new people, we will take you. It's not difficult. It's no complex, filling on forms. Your name, where you're from, what's your specialty? Okay, I'm this, that, the other. Send us your name. Are you ready to travel? Yes. We take care of all the costs. You don't pay anything. You give us your time. You take care of your own locums, kind of stuff. The second one is the outreach programs in the country, the primary health care. And the third one is what we did now in Kimberley Hospital. We're going to be expanding into many, many more missions like that within the country, within government hospitals, sending in specialized teams.
Is there like an email address or some like a contact number
Yes,
or website?
Info at giftofthegivers.org.
Okay, all right. Alex,
and
would you
it's
mind?
on my website. It's on my website. It's there.
Okay, all right. Go to the Gift of the Givers website. Okay. All right. The next question. Sorry, while I'm just reading these questions, can I ask you another question? And
Sure.
that is, what's your annual budget?
The last 3 years, 2 to 3 years, it's cash and kind. If somebody offers us 10,000 in cash and say, I've got a container of food, we tell them, keep the money, give us the container. But the container is worth 100,000 rand. So if you look at local and internationally, for the last 2 to 3 years, it's something like 500 million per year.
Per year, sure. It's a lot of money. Okay. Sorry, I'm just scanning the questions quickly. Best talk of the year, absolutely wonderful. Okay, there you go. Thank you. Okay, there's a question regarding sharing the talk as far as possible. Mandatory listening for every South African. Would you mind if we put it up on our website?
My life is not private. Everything on me is public.
And at our YouTube channel.
You can put it wherever you want. It's not a problem.
Okay. Why is the Department of Health not prepared to fund projects that GOTG are doing for public hospitals? Sorry, Gift of the Givers are doing for public hospitals.
The same story. We have no budget. And remember, because of corruption, because of giving friends and people the contracts, people will only give you a contract if you're prepared to put something under the table. We don't do that. And we don't do it for government. But while saying that, there's a lot of good people in government. Everybody's not a crook. Everybody's not corrupt. There's a lot of good people who want to do a lot of good things. Just like the whistleblower person, they're afraid. They're afraid to challenge. I mean, I'm sitting right now in Port Elizabeth, Gqeberha, with the top police commander of the city. We know General Nkata. We know him well because he was in Cape Town. He's a friend of ours, and we always support police action. And in the room, one person raises a question to say that the chief of some forum in some police station, when goods come, he takes the most for his family first. All the police have seen that, and they're unhappy with what they see, but they're too afraid to speak about it, to say that this is happening, this is wrong, I don't know what to do. So tonight we told the general, and he said he'll deal with the matter. So people want to do the right things, but they're scared. So in that way, even in the health system, people who won't speak out, they'll tell you. And some people are brave, they will stand out and speak, but we're not waiting for them. At some point, when the ethics come in government and the turnaround comes, and they find, in fact, I've been told that one of the ministers said clearly, I won't say which minister from which department, said, why do we give contracts to people? Why don't we just give it a gift of the givers? It works out much cheaper, more efficient, and faster.
Absolutely, the job will get done. But that's also because you don't worry about the red tape. You just
I specialize in breaking rules.
That's fantastic. Okay, there's another question here. Where do you get some of your funding or a lot of your funding from? Are there sort of annual donors? or do you spend a lot of, I'm assuming you must spend a lot of your time going around and meeting people?
Understood. We got a policy. We don't have fundraisers. That's our policy. The spiritual teacher told me, I keep saying the spiritual teacher, I didn't introduce that in the background because it wasn't relevant to the talk. But the gift of the givers was formed by the instruction of a Sufi spiritual master in Turkey, who gave me the instruction to form the organization. And every time I met him, he would tell me something different. And he told me, my son, you will never look for money. People will come from all over to give you money. And to be honest, we're in the fortunate position of giving the corporates a number to tell them we can only see you next week, Thursday, or in 2 weeks' time, or this afternoon, to talk to you. And because of the quality of our work, and they see the impact we make on the country, they wait. They come from all over, but not only the corporates. We've got pensioners, school kids from the money box, schools collecting money, small business people, women working from home, professionals. It's the whole country. Now, let me give you a classic example. There's a school in Orange Farm where the kids don't have shoes, don't have a jersey, don't have a school bag, don't have a lunch. And it's a very poor school. When the famine in Somalia set in 2011, the kids in this school raised 30,000 rand in a school where they need the money themselves. It's the Ubuntu spirit of South Africans that makes a huge difference. Yes, corporate support us, private charity trust support us, this family trust and that family trust support us. But in the recent months, we're finding that international donors are also coming. Walmart, Ford Foundation, Microsoft, Gates Foundation, and the list is starting to increase. When more international people are taking embassies, Australian embassy, Canadian embassy, Swedish embassy, German embassy, all taking notice of what we're doing. And starting off small, but we know those figures are going to increase.
Okay. Okay, so there are a lot of comments, but not too many further questions. So I'm going to leave the comments up so we can browse through them if you'd like to. There was one question to ask if this person can put you in their pocket to keep them motivated on a daily basis. I'm assuming you're too busy for that. Okay, and then last question. Is there a Care for the Carers program for allied healthcare professionals or even diagnostic health professionals, medical professionals?
Within our system, we got our program for our own teams, not the insiders.
Yeah.
We have our own counselors. We got our own counselors. We got 21 different categories of projects. We don't only do health. We specialize in disasters, but we have our own counseling teams. We have counselors that work with us. We got our counseling service. But as I told you, nobody wants counseling secondary traumatization. It's first time during COVID. Every other mission we went, the guys were affected. They would sort of counsel themselves. They would find and talk among themselves, laugh, make silly jokes, say things, and take the pressure off the system, especially in the war zone. And most people will be fine with that. But during COVID itself, I saw my own teams and healthcare professionals in general, and that's specialized care. You need to know what the hell you're doing. So we don't have full-time psychiatrists and psychologists working for us. It's just not feasible. You have voluntary people, and a lot of voluntary people have offered to provide their services certain days in the week, certain times in a month. So it's a specialized field which we won't interfere in. Our counselors take care of our own people.
Okay. All right. I think those are all the questions that I can ask. Okay, sorry, very, very last question. In fact, I think you answered this question. What inspired you to do what you do? It was
spiritual teacher.
Spiritual teacher.
I give to the givers. I don't get up one morning and say, okay, I think today I'll form an organization. I'll give it a name. I'll get founder members. I met a spiritual teacher in Turkey who instructed me to form the organization and told me, this is an instruction for you for the rest of your life. And said, remember, my son, that whatever you do is done through you and not by you.
Yeah, that's very powerful. All right. I think that then brings us to the end of the webinar. Dr. Suleiman, seriously, thank you so much. I think it was the perfect end for our year. It was a challenging year. I think you've given everyone a lot of inspiration, certainly a lot more sort of motivation in what they do. I think so many people have re-energized their the initial sort of quest for doing healthcare. And hopefully we'll be able to take this all into 2023 and serve our patients better and our communities better and South Africa in general in a lot better as well. So thank you so much.
And to you, Brian, and all the people on the webinar, a great festive season. May you be blessed, and let's look to build a new country, a better country for all of us together.
Thank you so much. Thank you. Everybody, hope you have a great festive season as well. Stay safe. Please drive carefully. And we'll see you all next year, January or February. Great. Thanks. Alex, thank you so much. Sorry, one last thing, just to remember that if you are interested in getting involved, the email address is info@giftofthegivers.org. Great. Thank you so much. Thank you. Have a good night. Bye-bye.
Bye.
Alex, thank you.
You're welcome. Cut-off time will be 9:10. You're very welcome, Amanda. We'll keep bringing you more and hopefully even more content next year as well. Amanda, if you have anything you would like to add, or ask, just please put in the chat and I will respond. Just a reminder, you need to leave the webinar before 9:10 to receive your CPD points for tonight. Yes, Naeem. You need to leave the webinar before 9:10. This is for everybody. Everybody needs to leave the webinar before 9:10 in order to receive their CPD points. You're very welcome, Rosaline. And we will put the edited version up. I think also on both NetTalks and the YouTube page, I think. You need to leave before 9:10. So before 9:10. So you leave now, but if you leave after 9:10, we're assuming you just left your computer running and didn't watch the webinar. So please leave before 9:10.